right, thanks for joining us today. Jamie and myself, I'm Jamie as well, are going to be showing you the two-person line change technique. That's kind of a new practice that we're doing here in our NICU. For today, I'll be the sterile nurse, Jamie will be the clean nurse. We do have a policy, so always refer to the policy, but this is just a video to kind of help if you've got any further questions. So first, what we're going to do, this is our bedside table where we're going to end up priming all of our lines. Most important is to definitely always clean it off first. Go with whatever the manufacturer's guidelines are. It's different for each product. So make sure that you have your hat on, your mask on as well, gloves when you're doing this. You're going to want to clean this off. As I said, per the manufacturer's guidelines of allowing it to dry. At this point, you're going to want to end up taking those gloves off and throwing those out in the trash can. And this is the time that you're going to want to rewash your hands. So fast forward in time, let's say that per the guidelines, this is dried per what the manufacturer recommends. At this point, a little bit of a change in our practice is, and the CDC's guidelines are asking that people wear gloves when touching things, even when not sterile, clean gloves. So a little bit of a change of practice when we're gathering all of our supplies, we will wear clean gloves for that. So this is a line change that we typically do on our Mondays and Thursdays here that we'll kind of be gathering some supplies for. So I've got my sterile drape there that I'll be ending up using. I have my IV fluids. I've got my lipids, my flush. I always kind of think about what's closest to baby and work my way up to make sure I've gathered all the right supplies. So Clave is going to be closest to where the baby is. Then I'm going to have my Trifuse as well. I'm going to have a Medline and a Clave. I'm going to have my TPN tubing and my filter as well, and my mainline fluids as well. I'm going to keep a couple 2x2s over off to the side, and then the Prevantix as well that we can open up here in a little bit. These can sometimes be a little tricky to open. I'm trying to not touch any of the sterile part as I kind of open this up. Sometimes maybe visualizing a good 1 inch to 2 inch around the border is not sterile, just to kind of keep that in mind and try to put everything in the center. The Clave is going to be closest to the baby. Trifuse next. Lipids filter. And the tubing, and however it gets it organized in your head as far as putting stuff down, there's not one right way or wrong way of what order you're putting things down. Got your tubing. This one is having a hard time getting out. Up like a banana to maintain being sterile. Okay. All right, so I pretty much have all of my stuff gathered. Now it's time to assemble everything. As we had said before, I'm going to be the sterile nurse. Jamie will be the clean nurse. So she'll be my helper. now that we have our sterile gloves on, if Jamie is also going to be handing me other things and handing me equipment, I'll make sure that she also has just a clean pair of gloves on. So if she wants to put those on here shortly, that would be great. But otherwise, I will start assembling all of my tubing here. And you can see here that there's one closest to the baby, this one. That's where you'll always want to have your med line. Sure that you've got a clave at the top of your med line. All right. For these here, it doesn't totally matter which one is your mainline fluids and which one is your lipids, so you can choose. You can see like a lot of the ends of the caps. I try to keep those on just in case. The table should be sterile, but it just helps kind of an extra step in order to make sure that the tip stays sterile as well. When priming these, a lot of times it is easiest. They tend to kind of to clamp them only while priming. So I'm going to end up doing my mainline fluid last, maybe my lipids second. I'll start with my flush here. So this is a little bit of a change in our practice of how we're going to go about doing this now. I'm going to stay sterile. You can see Jamie's got clean gloves on as well. She's holding the syringe there that is not sterile, the outside of it, but the end part is. So I'm going to hold this here. And I'm just holding that still and kind of more letting her do that part of it. Because the syringe is not sterile, I don't want her to put it back onto my surface here. Okay. And you can see maybe one more drop to make sure. Perfect. And you can tell it's dropped here. This is lucky that it doesn't sink beneath, but if you're using sterile towels or anything that absorb, you just want to make sure that you're dripping into a container and that this isn't becoming saturated. So you can see Jamie put that to the side over there. I don't want it on my sterile field. All right. So here is our lipids line. You can see we have the filter here closest to the baby off of the trifuse. And I'm just holding myself still while Jamie kind of screws that on there as well. I'm going to let her push that down. You can either do it the way she's doing. Sometimes big lipids are kind of hard to push through, so you can always turn it upside down just like how she's doing now if that's easier to prime, whatever you prefer. Is that flushing, Jamie?
Is it not going through the filter? Did it go? Oh, it's going through the filter right now.
Yep, almost there. I can see it kind of priming there. Perfect, and I can see it all the way at the tip there. Awesome. All right. So I'm going to clamp that one, and we're going to follow with our last one, which is our...
Move a little closer to the baby.
Yeah, you want to move it now?
Hang it?
Yep. So I'm going to let her go ahead and move this since she just has the clean gloves on. No right or wrong way to prime this. I try to kind of have it a little bit clamped and slowly open it. I find that there's less air bubbles, but as I said, there's no special way to do this, whatever kind of works in your practice. So this is a little bit of a change of how we used to normally do it. So what I'm going to do is I'm going to hold this here. This is all sterile. What Jamie is holding the bag is not. So she's going to maintain being clean. I'm going to maintain being sterile. Twist that in there. Perfect. All right. I'm going to give it a little squeeze. And there shouldn't be a reason for me to touch that again. So I'll let Jamie kind of be in control of that there. And I'm going to kind of slowly open this. Get all my lines primed here. See it kind of priming all the way up to here. Perfect, and we're all the way at the tip. And I definitely do want to close those because when we connect it to the baby, just don't want to have any fluids being bolus to the baby. So a little bit of a change in our practice too of how we're doing it right now. I'm going to have Jamie put two 2x2s on. If you choose 4x4s, that's fine as well. Just something that you can kind of use to help maintain sterility. We are using Prevantix now. That's kind of a change in our practice per our policy, but whatever. All right, perfect. So I'm going to kind of step aside and maintain being sterile here. Yeah.
I'm going to remove the old line on the top of the clave. So I'm leaving the blue clave in place. I'm removing this. I would pause my fluids. And then with the clave still in place, I'm going to open my Prevantix. I'm going to clean at the little junction, 1 inch above and 1 inch below for 5 seconds. And then we're going to let it dry for 5 seconds. And now it is your turn.
Perfect. And if you don't mind just clamping sometimes if you've got umbilical lines or this, they do kind of bleed back. So I'm going to end up using that. Right now I can probably take this off. I've kept my cap on just till the end just to help maintain it being sterile. And this is the point that I'm going to end up, Jamie, if you don't mind kind of grabbing the other side. Perfect. So I'm going to kind of hold this and I'm going to use these almost as a set of hands in order to maintain being sterile. So I'm holding onto that there. I'm going to take off the clave. Using my sterile 2x2s, and you can see that there that I'm still maintaining sterile with my hands here. I'm holding that there. I'm grabbing the Prevantix, and you don't want to put it inside the junction, like into the hole, but you definitely want to wipe the outer end with a little bit of friction here. So for a good 5 seconds. So 1, 2, 3, 4, 5, and allow that to dry for 5. Perfect. I'm going to grab my clave here with all my fluid that I do have turned off now so I don't bolus the baby, and we're going to connect that. All right, so at this point we are fully connected and don't need to be sterile anymore. Anytime we're dealing with IV lines, we definitely still want to maintain wearing gloves. They don't, either clean gloves or sterile depending upon what stage of the process you're in. But that's pretty much how you connect everything, and then from there you would just set your pumps accordingly.